Hello, my name is Melanie Bolito, and today we will discuss natural product therapies used to treat the mental disorder depression. A mental disorder can be described as a significant disturbance that interferes with an individual's emotions, behavior, or cognition. Typically, this will cause significant distress in a person's life. In 2019, it was estimated that 1 in every 8 people suffered with a mental disorder worldwide. However, since the pandemic, that number has been increased by nearly 27%. Common mental disorders include anxiety disorders, depression, bipolar disorder, post-traumatic stress disorder, schizophrenia, and eating disorders. Individuals who live in poverty, are exposed to violence, are disabled, or deal with any kind of inequality are at a much higher risk of developing a mental disorder. Sometimes mental disorders may also be genetic. Specifically in lower income countries, resources for mental health are few and far between, or often inaccessible. There's also a stigma and discrimination surrounding mental disorders that make it difficult for individuals to seek treatment. Mental disorders have cost Americans around $280 billion in 2020. This is largely due in part to time taken off work, inability to work, and treatment often not being covered by insurance. Depression, otherwise known as major depressive disorder, is a mood disorder that can be characterized by persistent and heavy feelings of sadness and disinterest. This can have an effect on day-to-day activities and even cause suicidal thoughts. Symptoms of depression include feelings of sadness, emptiness, hopelessness, loss of interest, anger, sleep disturbances, and can even cause physical symptoms such as back pain or headaches. Diagnosis is typically done by a psychiatric evaluation. The two conventional major treatments for depression are medications such as antidepressants or psychological therapy, including hospital and residential treatments. Depression is a very common disorder, with about 5% of the world estimated to have it. All individuals of any age can suffer from depression. However, adults over the age of 60 have a higher prevalence. In low-income countries, 75% of people receive no treatment due to lack of resources and the social stigma associated with depression. Individuals who have gone through adverse life events are much more likely to develop depression, specifically low-income individuals. Depression has cost Americans $236 billion in 2018 and has only risen since then. Individuals who suffer with depression often end up missing days of work, social gatherings, causing further isolation. The pathophysiology of depression is complex and still being understood. However, generally the mechanism of depression is said to be caused by the depletion of monoamine, neurotransmitters serotonin, epinephrine, or dopamine in the central nervous system. Oftentimes this is directly caused by stress or significant events. However, there can also be no known cause to it. The amygdala, the thalamus, and the hippocampus also play a significant role in the mechanisms of depression. A lack of production of new neurons in the hippocampus is said to cause low moods, which is why antidepressant medication is said to help, because it helps nerves grow and form new connections in the hippocampus. However, there is no single hypothesis which explains all aspects of the signs and symptoms of depression. Vitamin D is classified as a micronutrient that can be found in nature through different forms, such as D2, found in mushrooms, and D3, found in fatty fish or formed in our body when exposed to sunlight. Additionally, many foods are already fortified with vitamin D, such as dairy and orange juice. Vitamin D supplementation is traditionally used to treat vitamin D deficiencies and aids the body in building and maintaining healthy bones. One mechanism in which vitamin D may work to treat depression is by restoring calcium and neurotransmitter imbalances. By doing this, it regulates glutamate and GABA cellular signaling in the body, helping to restore mood. Furthermore, vitamin D has also been shown to regulate the production of monoamine neurotransmitters, such as dopamine in the adrenal cortex, which helps prevent the depletion of dopamine and serotonin. In a randomized double-blind trial located in Norway, they examined vitamin D levels in adults with a BMI considered within overweight or obese categories, then assessed the effect of vitamin D supplementation on their depressive symptoms. A dosage of 20,000 or 40,000 international units of vitamin D per week or the placebo was given for 1 year to 441 subjects. The Beck Depression Inventory (BDI) test was taken before and after the dosages were given for comparison. What they found was subjects who had vitamin D levels less than 40 nanomoles per liter scored significantly higher on the BDI, meaning more depressive traits, than those with vitamin D levels greater than 40 nanomoles per liter. In the groups that were given vitamin D, there was a significant improvement in BDI scores after 1 year, meaning depression symptoms lowered. However, there were limitations to the study. Because it was only done on individuals with a BMI of overweight over obese, it is unsure if these results can apply to those within a normal BMI, as individuals with a BMI of overweight or obese may require more vitamin D to maintain adequate healthy levels or to correct a deficiency. Authors also acknowledge that they are still unsure if vitamin D's effect on depression was a direct one on the brain or if indirectly through its effects on calcium metabolism. Safety-wise, during the study, 5 participants ended up having higher than normal calcium levels that needed to be monitored. 126 other adverse events were recorded, most of them being recognized as gastrointestinal discomfort. In another randomized clinical trial located in Iran, the trial aimed to assess the effect of vitamin D supplementation on the treatment of depression in older adults. Over a period of 8 weeks, 78 adults over the age of 60 with a moderate to severe depression received either 50,000 international units of vitamin D or a placebo weekly. Baseline vitamin D levels were taken and a geriatric depression scale score above 5 that represents moderate to severe depression. Results found that the GDS scores decreased from 9.25 to 7.48 in the vitamin D group. This means that there was a decrease in depressive symptoms. There was no significant decrease in depression scores in the placebo group. There were some limitations to the study, including multiple confounding variables that were not controlled for. All participants were also over the age of 60, meaning results may not be applicable to individuals under the age of 60 because older adults tend to not absorb vitamin D as well and have a different diet. To ensure adherence, participants were asked to bring in a medication containers in order to count the remaining capsules. Although they found 100% adherence, it is unlikely that every participant took every dose. Because the trial was only 8 weeks long, there were no adverse events reported. More time is needed to observe long-term outcomes. In a case series study located in Sweden, depression in adolescents and vitamin D was studied to evaluate the effects of vitamin D supplementation. 54 adolescents were given vitamin D3 over 3 months, 4,000 international units daily for month 1, 2,000 international units daily for the remaining 2 months. Before and after the study, they were evaluated with a well-being scale and a mood and feelings questionnaire, MFQS. Vitamin D levels were also tested. Results show that after supplementation, there was a significant improvement in depressed feelings and associations with it such as mood swings, difficulty sleeping, and irritability, with scores from 14.7 to 7.1 on the MFQ, indicating a lowering in depressive feelings. This was correlated with an increase in vitamin D levels. In limitation, there was no comparison group, so results cannot entirely be attributed to the vitamin D supplementation. The study was also done in adolescents, which require less vitamin D than adults. No adverse safety concerns were noted. However, authors acknowledged that the supplements used were from a laboratory, and different laboratories may not have exact measurements of vitamin D. The findings of these 3 studies suggest that vitamin D supplementation may help decrease depression symptoms in certain individuals. However, dosages ranged from 2,000 IUs to 50,000 IUs weekly, so it's difficult to say what the appropriate dosage for effectiveness may be. Another important note to mention is that the authors of all 3 articles mention the uncertainty of vitamin D effectiveness only being significant in individuals who were vitamin D deficient, meaning supplementation in depressed individuals who already have adequate vitamin D levels may not be effective. Safety-wise, there is a potential for such high doses of vitamin D to cause gastrointestinal issues and increase calcium in the body, leading to kidney stones over time. Most of the studies were done on specific populations, which can make it difficult to generalize the results to the general population, as individuals at different life stages need or can absorb more or less vitamin D. The quality of vitamin D supplementation was also under scrutiny, as different brands may carry different measurements even if the same dosage is listed. Another common supplement used to treat depression is Rhodiola rosea. Rhodiola rosea is a plant primarily grown in the regions of Europe and Asia. Traditionally, it's used to increase mental and physical endurance and treat altitude sickness. Rhodiola rosea is classified as an herbal botanical supplement. It is known to have adaptogenic properties, helping the body adapt to stress. Rhodiola rosea impacts the HPA activity axis, which positively modulates the central stress response. Because it modulates the central stress response, it enhances and stimulates neurotransmitters, noradrenaline, serotonin, dopamine, and acetylcholine receptors in the brain regions that control mood. In a randomized, double-blind, placebo-controlled trial located in Pennsylvania, 57 participants over the age of 18 were randomized into 3 groups. One group taking 340 milligrams of rhodiola extract, one group taking 50 milligrams of sertraline, an antidepressant, or a placebo for 12 weeks. All participants had a diagnosis of mild to moderate depression prior to beginning the experiment. Additionally, all patients took a Hamilton Depression Rating (HAM) D test and a Clinical Global Impression Severity Test (CGIS) test before and after the experiment. Results found significant reductions in the Hamilton Depression Rating scores for both rhodiola and sertraline groups. The sertraline group had a 3.6 reduction in the Hamilton Depression Rating scores than the placebo, whereas the rhodiola group produced a 0.5 reduction than the placebo. Both results showed a reduction in depressive symptoms. Although rhodiola was not as effective as sertraline, it also resulted in significantly fewer adverse events and was much better tolerated, presenting a more favorable risk-to-benefit ratio as a treatment for depression. The authors stated there were no serious adverse events related in the group taking rhodiola, but did not state any mild adverse events. Limitations include that the study was only done on individuals with mild to moderate depression and may not display efficacy potential for those with severe depression. The authors also acknowledge that they are likely to see a better result with an increased dose. In another randomized, double-blind, placebo-controlled clinical trial located in China, 100 patients ages 18 to 50 years old were randomized into 3 groups for 12 weeks. Group A taking 1 sertraline capsule and 2 placebo capsules, Group B taking 1 sertraline capsule and 2 rhodiola capsules, and Group C taking 1 sertraline, 1 rhodiola, and 1 placebo capsule. Additionally, all participants had to have a score of 12 and above, or 12 and below on the Hamilton Depression Rating, HAM, meaning they had mild to moderate depression. Results found that Group B, the 1 sertraline capsule and 2 rhodiola capsules, had a much greater reduction in the Hamilton Depression Rating scores than Group A or C. These results show that doses of 0.3 or 0.6 grams were effective in lowering depression symptoms, and higher doses likely cause better results. There were no treatment-related serious adverse events. Patients actually reported adverse events using sertraline with placebo versus sertraline with rhodiola capsules. In limitation, rhodiola by itself was not tested for standalone efficacy and was only tested in addition to sertraline, so the study could not speak for rhodiola's true efficacy for depression. In another randomized double-blind placebo-controlled study done in Armenia, 91 participants aged 18 to 70 were separated into 3 groups over 6 weeks. Group A received 340 milligrams of rhodiola per day, Group B received 680 milligrams of rhodiola per day, and Group C received a placebo. The Beck Depression Inventory (BDI) was given for comparison of depression before and after the experiment. Results showed significant improvement in overall depression in groups A and B, the group taking rhodiola. The study showed that rhodiola has antidepressant potency in patients with mild to moderate depression when administered in dosages of either 340 or 680 milligrams a day. However, because the study was only 6 weeks, safety and efficacy for a longer period of time is uncertain. During the duration of the 6 weeks, there were no adverse events reported. Based on the evaluation of these 3 studies, rhodiola extract may be safe and effective to treat depression, especially when combined with a common antidepressant such as sertraline. Based on these results of a systematic review, rhodiola extract has significant results for the treatment of mild to moderate depression, but for severe depression, it is unknown. 2 of the studies only evaluated the efficacy of rhodiola in combination with sertraline, and while not as effective as sertraline, they still found rhodiola effective overall. The last study showed rhodiola had a strong efficacy on its own. Dosages varied among the studies from 350 to 680 milligrams daily, with the higher doses showing a stronger efficacy on decreasing depressive symptoms. None of the studies reported adverse events. However, most of the studies lasted 6 to 12 weeks, and longer studies need to be done to evaluate the safety of long-term use. However, mild side effects may be dizziness or dry mouth. The standardization of herbal supplements like rhodiola are loose and can have an effect on the quality and dose you may be receiving. Both vitamin D and rhodiola can be used as supplements to help aid in the treatment of depression. However, it's important that dosage and safety information is followed. Appropriate dosage of vitamin D will depend on your current vitamin D levels and should be discussed with your doctor, although it's important to note that 4,000 international units daily of vitamin D is the tolerable upper intake limit for adults. Adults with a vitamin D deficiency may need upwards of 50,000 international units a week to see a reduction in depressive symptoms. Nausea, vomiting, and constipation are the most common side effects with vitamin D supplementation and can become dangerous if you take them in high doses. For rhodiola extract, doses of 340 to 680 milligrams a day may be effective in decreasing depression symptoms in adults. However, it is important to note that herbal supplements such as rhodiola are typically made in laboratories, and therefore their dosages and ingredients may not be accurate. Side effects of rhodiola are typically uncommon and very mild if taken in appropriate doses. Before you take any supplements, it's important to discuss it with your doctor. While vitamin D and rhodiola can both be purchased over the counter, there are also other natural products that have shown a level of efficacy to treat depression, such as St. John's wort, which is a plant-derived herbal supplement, omega-3 fatty acids, a micronutrient, and saffron, which is a spice. A popular mind and body practice used to help depression symptoms is meditation. Meditation is where you enter a deep state of relaxation through mindfulness and keeping focus. Meditation helps prevent negative thinking, emotions, and physical sensations from taking over your thoughts, thus helping to control negative feelings and helps to cope with depression. There are many online tutorials that show different ways to meditate, and some can be done in as little as 5 minutes a day. Here are my references. Thank you for watching.